Hello, this is my presentation for a discharge summary. This is one I did this past semester. The admission date was January 23rd, discharge date was January 25th. The admitting diagnosis was smoke inhalation, and discharge diagnosis was smoke inhalation. Consults were Child Protective Services and Center for Miracles. Only procedures that were done was a chest radiograph and a carboxyhemoglobin to follow the CO2 in the patient's blood. History of present illness. Patient is 2.5-year-old male with no previous medical history. He was in the usual state of health when there was a fire in their home. Per the mother of the patient, the twin brother and the patient were placed in their respective playpens in mom's room for bedtime. Boyfriend then states that he closed the bedroom door and joined the mom in the living room. Boyfriend then returned around midnight to mom's room to turn off the TV, and states he started calling out for the mother when he noticed that one of the playpens was on fire. The boyfriend then grabbed both children and placed them outside, and the mother notes that both children were both awake and responsive at the time. She then called her mother, who directed her to call 911. Mom then tried to put out the fire with water prior to EMS arriving. The patient was taken to outside hospital and transferred to University Hospital for the higher level of care. So the patient doesn't have any past medical history, any past surgical history, or any noted medical issues at this time. Social history just lives with mom and mom's boyfriend in their house. For the hospital course, the patient was evaluated in the emergency room, had a chest x-ray which was reported as a negative read. His initial labs included carboxyhemoglobin of 1.6, admitted for monitoring respiratory failure and placed on a non-rebreather mask. Patient remained stable. He was taken off oxygen and tolerated regular diet. Due to the age of the child and the circumstances surrounding the fire, CPS and Center for Miracles were consulted. Both services cleared the patient for discharge and with the mother, and they were able to go home. The patient was just able to discharge home. During this hospital course, the patient remained hemodynamically stable. He was tolerating regular diet. On day one, on the day of discharge, he is afebrile, alert, and oriented. He was stable on room air with oxygen saturations at 100% with no increased work or breathing. His lungs are clear to auscultation. Heart sounds are regular. Abdomen is soft with no tenderness or distension. He is moving all extremities without any problems. Discharge diagnosis. Patient was admitted and monitored for smoke inhalation. The patient remained stable during his hospital course with stable labs and taking PO well with no noted issues. His discharge condition is stable. His disposition, he's going home. Discharge medication, he wasn't on any. He's not getting any to go home on. For discharge instructions, he's on a regular diet. Activity is tolerated. No pending labs. We're asking for the mom, please follow up with pediatric trauma clinic only if needed. They got a phone number for them to call. Any questions or concerns? And please follow up with the pediatrician in 1 to 2 weeks. Other precautions: return to the EC for new or worsening symptoms, including fever 101.5, increased work of breathing, pain not controlled by medication, over-the-counter medication, nausea, vomiting. There's no wounds. There's no wound care. And the patient does not have an established PCP, so we're given a copy of the discharge summary provided to the parents when they finally establish a pediatrician for their kids.